getting into a relationship and eventually getting married, it is the sweetest thing ever. But how do you prepare before you get into a relationship? We know most of the time, okay, you look at yourself and you love a lady loves you, and you start a relationship without actually thinking about the future. Now, what is the future? The future is that relationship can lead to marriage. There could be pregnancy within that relationship. If there is pregnancy, what are we gonna do? Okay, we'll decide to say that, okay, if there is pregnancy, we'll move on, have our kids. But now, did you actually prepare to accept that pregnancy health-wise? So we bring to you today the most important, that's the most essential test you should do before getting into any relationship. It should not be that before you maybe get into marriage. No, it should be that before you get into any relationship, you check out this, and the two of you both should do it. The first thing is your blood grouping. Both of you should know your blood grouping. Now, this goes especially to the lady. I know to the man, blood grouping will not really have an impact when it concerns you having a relationship. But to the lady, it is so vital. So, the very first thing is blood grouping. To the lady is vital because if the blood grouping is a rhesus negative, then you need to understand that rhesus negative, when you put to bed, you will need to follow up with your doctor. You need to take an injection immediately after you put to bed. So that is why blood group is so important, especially to the lady. The next thing is hepatitis B. Hepatitis is essential for everyone. But now if you're getting into a relationship, you need it such that maybe you don't infect some other person. If you are hepatitis negative, you vaccinate yourself as early as possible. The next thing is syphilis. You do a syphilis test. Syphilis is one of the STI that is common. We know you can as well do other things, but at least you should do syphilis test. If it is negative, good. If it is positive, you get treated. The next thing is HIV. HIV, some people still ask for signs and symptoms for HIV. No, you don't ask for signs and symptoms for HIV because HIV will actually manifest in a slow way, and before you know it, you must have been infected for quite a very long time. So you have to get tested regularly. Before you get to a relationship, you need to do it. If you are negative, good, you respect and you stay negative. If you are positive, you follow your treatment and you see how you can move on. The next thing, which is the most important, is the HPGenotype. The HPGenotype test is a test that you do such that if you eventually have a child, that child, there should be no probability for that child to be a sickler. But if you don't do this test, there is a probability that what if your partner is AS, just like you, maybe who is AS, then there is a probability for you to have a sickler as a child. So HPGenotype, which is the HB electrophoresis test, is very important for you to do before you get into any relationship. So all of these tests, you need to do it before you get into any relationship. Do not wait that until you're getting married. I just hope this will help somebody somewhere. There are many other tests, but we just chose these other ones because of what I've just explained. Thank you so much. May God bless you. Please keep safe. Have a wonderful day.